Good morning. This is Ned Mumtaz. Welcome to the webinar on transparency analytics, contrasting reporting requirements between the Sunshine Payments Act and EFPIA. Welcome to all the participants. I also have a colleague from King & Spalding, Elisabeth Kohoutek, who will be joining me in this webinar, and we are ready to get started. So quickly, the agenda. We'll go through the bios of both myself and Elisabeth in terms of our background, and then we'll walk through 4 topics related to US and EU compliance for pharmaceutical, drug, device, and biotech organizations. And we will cover 4 aspects of it. First, US and EU regulations summary. Then we'll go into a couple of things that are very specific to EU in the space of transparency. Those are physician consent management and GDPR compliance, which is the new regulation that's expected shortly around data privacy. And then I'll walk through both US and EU analytics data and options for different techniques to utilize all the information that's now available for several years in US and at least a couple of years in EU. And I certainly encourage you to ask questions throughout the process. You can send in your questions as they come in. We will take those and look to address them. So very quickly, my name is Ned Mumtaz. I'm an associate partner and a practice leader at qordata, life science practice. Over the last couple of years, I have advised to over 120 drug and device manufacturers, both in US and EU, around their compliance management and more specifically around data and analytics related to compliance function. I've also had an opportunity to share with the industry over 20 or so webinars and around a dozen conference presentations, both in US and EU. Prior to joining qordata, I was in the industry. I was a director at Wyeth Pharmaceuticals for around 10 years, and at Eisai, Otsuka, and Schering-Plough for another 10 years. So it's my pleasure to present to you this topic today, along with Elisabeth Kohoutek. Elisabeth is with King & Spalding, and she has also spoken to several webinars, as well as been part of several conferences where she has presented several topics, including EU analytics as well as EU compliance regulation. She brings tremendous experience in life sciences practices, advising both legally as well as from a business standpoint to organizations. I want to give Elisabeth a chance to say hello and maybe add to her background and experience. Hi,
thank you, Ned. Hi, Ned. Thank you, and good morning to everyone. Thanks for the introduction. As Ned already mentioned, I am an attorney based in Frankfurt, Germany. I am advising mainly in the life sciences field, helping our clients from the pharmaceutical industries and medical device industries, and also cosmetics and food industries to develop and produce and distribute products in a compliant manner. So we are helping our clients to understand the legal requirements and regulations that come along with the manufacture and distribution of those products. And this includes really a broad range of topics, starting in the manufacturing process, in the composition of a product, in the setup of a product, going over through labeling and advertising, and also nowadays a lot with digital health, with compliance with data privacy regulations and transparency regulations and so on. So we really advise our clients in the whole life cycle of their products. And of course, I'm always happy to speak and share this knowledge with you in webinars and conferences. So I'm glad you invited me to speak today, Ned.
Thank you for joining, Elizabeth. Appreciate it. Attendees, my experience has been where, as the new regulations came in, especially around GDPR, Elizabeth has been phenomenally valuable in advising and guiding both our customers as well as attendees to various conferences and webinars. So hopefully you'll benefit from her expertise and knowledge today. I also want to call out that there are 2-3 aspects that drove this webinar. The first one was around compliance professionals, as you are beginning to get a pretty large warehouse of data and information, both for the drug and device manufacturers as well as biotech manufacturers. There were a lot of questions that were coming up, especially at a conference that I recently attended in Philadelphia. And the question was around opportunity for expanding a common data set from US up to EU and trying to see if there were commonalities in that data set, what were some of the differences, how could one go about doing that, how could one benefit from it. So I want to be transparent in sharing that part of the motivation for this webinar was to give compliance professionals in US a little summary level information on EU transparency and related elements, if that's something which is new for you. And again, we are very fortunate that Elisabeth is with us. So if you have any legal questions around those regulations as she shares them with us, you're welcome to ask those questions. And then also this would give a quick visibility and view into US regulation for those of our participants who are joining from EU. So with that, I want to set a primer up, and then I will transition over to Elisabeth to give us an overview of some of the regulations in play. So this is my view, and that view is that the transparency challenge from a pharmaceutical industry standpoint is an opportunity to partner with physicians and healthcare organizations. We feel that in our observation, the progressive manufacturers in the pharmaceutical and device industry are looking for ways to streamline HCP interactions, and we'll share some ideas around that today. Conversely, I've had an opportunity to speak to several physicians who have shared that their capacity in terms of resource as well as time is truly constrained, and they are really looking for manufacturers who have certainly a broader breadth in terms of capacity of both resources and also time to be the ones who drive that partnership and streamline those interactions. And also, just to bring that point home, what physicians share with us is that they have several roles to play. Most important for them is on the far right. So here's an example of an ophthalmologist, and what he or she really would want to do is practice medicine. But in addition to that, in order to effectively operate, they spend a lot of cycles in billing and collection. They spend a lot of cycles in continuing medical education and licensure, and certainly with insurance of several types. And then lastly, they also want to stay current by reading, authoring, and often researching. So with all those other priorities, we feel that there's an opportunity for the pharmaceutical manufacturers and compliance professionals to help streamline that relationship, and their reaction has been that they're very willing and open to finding ways to be more effective in that interaction. So with that, I want to switch back to the focus on US and EU regulation, and I'll quickly touch on the US regulation, Sunshine Act. This is for the benefit of those of our participants from EU who may be new to this. So in quick summary, the intent of the Sunshine Act was to give visibility for financial transfers between drug, device, and biotech manufacturers and the recipients, which were licensed physicians as well as teaching hospitals. So the types of information that needs to be reported, this started in 2014, effectively for transactions that occurred in August of 2013 onwards. So the manufacturers are obligated to provide any exchange of financials, any payments of value to physicians or teaching hospitals. There are some exceptions. Those exceptions include samples and certain education materials. And also any indirect transfers are also required to be reported. And then lastly, ownership interest needs to be reported, especially that which has been offered as part of compensation. But other ownership interests where a physician or a hospital acquires stocks of pharmaceutical manufacturers in the open market, they're not required for the manufacturers to report. So that's a quick summary for the benefit of our EU participants. But with that, I'm going to ask Elisabeth to give us a more comprehensive summary of the EU regulation, as that's something newer, and our US compliance professionals have asked for getting clarity on it. So Elisabeth, if I can call on you to help the participants get better feel for the EU transparency landscape.
Yes, happy to do so. So in the EU, we do not have one law or regulation that covers transparency throughout the EU. So this is very different than in the US. In the EU, we have a couple of disclosure laws issued by the individual member states, which apply only in that member state. These are, for example, France and Belgium and Portugal and Slovakia. So we have a couple of countries in which there is a transparency law, and manufacturers operating in those specific countries have to ensure that they disclose their transfers of value with healthcare professionals according to these specific laws. Opposite, in the other member states, we do not have any laws, but the manufacturers decided to voluntarily show good effort and to disclose those transfers of value on a voluntarily basis. And they did it by entering industry organizations, national industry organizations in each of the member states, and those national industry organizations have an umbrella organization which is throughout EU, and this is EFPIA. EFPIA is the European Federation of Pharmaceutical Industries and Associations, and this European Federation issued a disclosure code. So it's a code issued by this industry organization, and all the companies that are member of that organization decided that they want to follow this code and to disclose the transfers of value in compliance with this EFPIA disclosure code. So the difference between two is, of course, on one side we have a law and disclosure laws, and in the other countries we only have this voluntary disclosure based on the disclosure code. And laws are, of course, enforced and committed by the government authorities, and if you violate those laws, it comes with quite high penalties, whereas a non-disclosure only and non-compliance with an obligation from the disclosure code is enforced and committed by the industry association itself, and usually it requires severe breaches to trigger any monetary penalties. So it's a bit weaker than a disclosure law, of course. And,
great.
Yeah.
So thank you, Elisabeth. Should I move to the next slide?
Yes.
Okay. And again, I want to encourage the participants that you have an opportunity to ask Elisabeth questions around the regulations as well as laws. This is your opportunity to ask for any clarification. She's very knowledgeable in this space, and the intent of this webinar, again, was to give our U.S. Compliance professionals an opportunity to get greater details if they wish to through this webinar. So thanks, Elisabeth. I'll keep an eye on questions coming in, but I'll move to the next slide.
Yeah, so the EFPIA disclosure code covers the collaboration between the industry and the healthcare professionals and healthcare organizations, and the transfers of value that occur in that surroundings. And the pharmaceutical industry under the code has to disclose payments that are made to healthcare professionals or healthcare organizations, such as sponsorship to attend meetings, or speaker fees and consultancy and advisory boards. And it intends to bring greater transparency in that relationship. And the disclosure code itself is, as I said, on a European level, and those national industry associations adapted uniform national codes. So when you are disclosing in the EU, you have to ensure and identify which of those national industry organizations your company is part of, and to which of those national codes you have to comply with. Those codes are more or less uniform throughout the EU, but have some few deviations from each other concerning, for example, disclosure language. Now, we have many different languages in the EU, so this language changes, and the disclosure platform changes a bit, because the member state organizations have the option to opt either for the way that the companies have to disclose the transfers of values on the company's own webpage, or they could decide to install some central platforms where all the companies can disclose this data via that platform. So there are a little bit deviations, so ensure that you check and are aware which of those national organizations your company is part of, so that you are can find out the way how you should disclose the data. And the general obligation under this disclosure code is, maybe if you could push the next slide next, and we can discuss those, it would be helpful. Yeah, the general disclosure obligation is that each member company should document and disclose transfers of value it makes directly or indirectly to a healthcare professional or a healthcare organization. And it has an annual disclosure cycle. Reports are always due by 30 June each year for the pre-current year. So now in June 30 of 2018, the companies will have to provide the reports for the year of 2017. There are templates available provided in the EFPIA code how to specifically provide those reports. And the companies are not only obliged to disclose information, but also to document all transfers of value made and to maintain the relevant records of this documentation for a minimum of 5 years. And companies can either disclose on an individual basis or on an aggregate basis. So on an individual basis, you would report for each clearly identifiable recipient, which is an HCP or an HCO, the contributions made to them and where the recipient can be identified individually. Of course, when doing so, when you are disclosing this information of a specific physician, you cannot do it without his consent. Therefore, sometimes when the physicians do not give this consent, you would have to, you cannot disclose on an individual basis and would have to disclose in an aggregated form, where you list the number of recipients covered by such a disclosure and the aggregate amount that is attributable to those recipients.
Great, thank you. So clearly, attendees, what Elisabeth has shared is both the motivation behind the EFPIA disclosure code, which is sort of self-regulation by the industry, as well as those regions and countries where the regulation has been enacted by the respective governments. What we want to do is next talk about a little bit about the aspect of consent management, because again, that is unique to EU from a data privacy standpoint, or parts of EU, and for the US, the regulation established that the physicians were obligated to allow the manufacturers to report on all the transfers of value. So I'm going to get into consent management a little bit, and again, I'll ask Elisabeth, with her expertise in the legal and regulatory aspect of it, to help you understand the elements of consent management and data privacy as it applies to the transparency regulation. So Elisabeth, back to you.
Yes, of course. So as you most probably may have heard about, applying from May 25th, from May 25th, 2018. So in a month, we will have a completely new data privacy laws in the EU. The new so-called EU General Data Protection Regulation will apply from May 25th on. And this is a law that applies throughout the EU in all the member states. So there will be only this one-stop shop. There is only the General Data Protection Regulation that you have to comply with, and not as it is at the moment and was until now, where we had to look into all those various national member state data privacy laws. So there were different data privacy laws in the UK, then in France and Germany and so on. And it was many different regulations that you had to be aware of. This is all replaced by this new General Data Protection Regulation. So when you enter or operate on the EU market, you have to ensure that you comply with that one, and then you are safe for your actions in the whole EU. The General Data Protection Regulation brings a number of changes. The biggest one is this so-called one-stop shop and the harmonization throughout EU, but also there are quite high administrative fines that are foreseen in the General Data Protection Regulation. So the amount of fines that can be imposed for breaches is much higher than it was till now. Under the new regulation, up to 4% of the worldwide, not just EU, of the worldwide annual turnover can be set as a fine for a case of really severe breaches. And natural persons participating in such infringements can be punished with administrative fines of up to 20 million euro. So this is really a very large scope of fines, and it's much higher than the scope of fines is currently. For example, to give you a number, under the German Federal Data Protection Act that is currently applicable, the administrative fine, the maximum amount that can be set is 300,000 euros. So that is a big difference. Also, another change under GDPR is that there are extended liability of controller and processor. So every person now, this is now fixed in the law itself, that every person that suffers a material and non-material damage as a result of an infringement of the GDPR can claim compensation liability for that, even explicitly of so-called MER data processors we differentiate here, just to give you a background of the terminology, between controllers and processors in data privacy law. Controllers are those who process personal data and decide why and for what purpose and what should happen to them. So, for example, we as a law firm are always a data controller, or you as a manufacturer of a pharmaceutical, for example, if you collect personal data in a clinical study, you are also a controller. If you use a vendor to support you, for example, in cloud services also, and it's really just this IT support this vendor provides, and you upload the personal data in the cloud and the vendor ensures that the data are stored properly, then this is only a so-called processor. So under GDPR, even if this processor, if this third-party vendor who provides the cloud services infringes GDPR, and a patient, for example, or an employee suffers damages of it, then there are claims for liability and compensation against that processor laid down in the General Data Protection Regulation. Another very important change is the extended documentation obligations that come with GDPR and the burden of proof. So now it is explicitly laid down that the controllers are responsible for and have to be able to demonstrate compliance with data protection principles of GDPR. What does it mean in practice? So if a company, if a manufacturer wants to disclose transactions with a healthcare professional, and he wants to do it GDPR compliant, he has also to have proof in his documentation that it is GDPR compliant. This means when you need to collect consent from the healthcare professional, and you also have to store that consent properly and be able to show that you have the consent when supervising authority requests that. So those accountability obligations are very intense under GDPR. So those are the main changes we face. Yeah, that's the slide to the General Data Protection Regulation. As said, that's the 2016-679 regulation, and it applies as it is written there from the 25th May 2018. So let's see what else. Yeah, the main changes.
So I think those are the two slides, Elisabeth, that I have.
Great. Do we have also something on consent?
I think the SOPs on the consent is what I have, which is what I can summarize.
So I can maybe share a bit of the consent requirements.
That'll be helpful.
Consent management. Great. So when you want to disclose under EFPIA code, you have to collect consent from your healthcare professional. And you, of course, should ensure that this happens in compliance with this now soon applicable GDPR. And GDPR provides a number of requirements for proper consent. And this is in particular that it says that any consent given from a healthcare professional has to be informed consent. What is an informed consent? So informed consent means that when a physician is giving consent to disclose his data, you have to properly inform him in advance about the whole data flow. So which data will you disclose? His name and the amount of contributions he received from you, maybe his address and so, his practice and so on. To whom will this be disclosed? Well, to your company and maybe to some vendors that you support you in providing that disclosure. And then, of course, you have to inform him that this will be disclosed on a platform that is online available and that anybody can look on. Then you have to inform him, yeah, what happens with this data. So you will process it, you will analyze it, you will upload it. So this whole data trail you have to explain to the physician when you are collecting his consent, so that he really knows what happens with his data. And your consent form should also list all the whole data flow, so that in that moment when the physician signs this consent, you already have also the documents which you can store with your in your archives, and when the supervising authority would come and ask you, please show us that you have all the consent forms for this disclosure, that you can compile it and give it to the authority. The consent must, of course, be freely given, so you may not somehow pressure the physician to give you the consent. If he does not want to have his data disclosed, you have just to say, okay, they're not, and then you will be only able to provide this aggregated disclosure. And best practice is to collect consent either written or electronically, so that you really have something that you can show. If a consent is also valid if it's given only orally, but if it's given orally, you have more problems to comply with your burden of proof. You would somehow have to write a report or something.
Right. So, Elisabeth, I'm going to jump in a little bit on the
Yes.
SOPs on this, but I'm hoping the participants got a very comprehensive overview of the GDPR regulation, which is around data privacy, and that extends to healthcare professionals, patients, even employees, because that regulation is for any natural person within EU, and certainly HCP would be part of that regulation. And then the existing regulation around consent management, of course, is applicable based on the existing EU regulations. And from a manufacturer compliance organization standpoint, I'll call out a couple of these data points around the standard operating procedures. So the first one is that you need to collect consent from a physician before you can disclose the payment details at the individual physician level. If you cannot or do not have consent from the physician, you still report the transfer of value, but that's reported at an aggregate level without naming the individual physician. And as Elisabeth pointed out, that you are required to maintain the documentation for a minimum of 5 years or longer if you intend to retain that spend record for a longer period. And then one last thing I want to call out around these SOPs is that you are expected to provide the HCP ability to revoke the consent. That's as important as collecting the consent. So if an HCP revokes the consent, you have a very limited time to then remove the details of payments at the individual level and then show it at the aggregated level. And very last, various forms of consent are acceptable, including digital signature, digital image on of signature on a paper, electronic recording, such as user ID and password by a physician going in online and doing so, and of course, if it's done on a piece of paper. So those are all aspects to consent management that is important, and that's unique to EU, whereas in US, that consent is implied based on the regulation. So again, there are some questions that have come in. So I would like to take a couple of those and direct them towards Elisabeth, as these are questions around regulation. So the question that came in, Elisabeth, I'll read that question out to you. question is that from your perspective, what is the extent of company accountability towards potential consent change for existing report when the disclosure data is hosted by third party, such as, and also the extent to which the right to be forgotten has to be applied if, again, the data is hosted or stored by third party. So I guess to summarize, if instead of the manufacturer directly storing the data in their own database, they are storing the information in a third-party platform, is there any change in that obligation for both recording and adjusting to consent changes, as well as the right to be forgotten? Elisabeth, if the question is clear, could you address that for us, please?
Yes, happy. So happy to do so. So if there is any change in a consent status, you as manufacturer and as collector of that data are obliged and have the responsibility to follow up with that. So irrespectively whether you store the data on your own platform or via a third-party vendor or someone else operates your platform, you have to ensure and take care for the change be followed up with in the disclosed data. So when you are working with a third-party vendor or a platform provider, you would have to reach out to that platform provider as soon as possible and as soon as you've learned of the consent change and request him to adjust the report. So this is very important that you do it really as soon as possible and within a very short time limit. You cannot leave the data if in the disclosure document, if the physician revokes his consent to disclose, then you really have to take care that the data is removed from the report.
Excellent. Thank you. Thanks for that answer and that clarification. We have a couple more questions that have come in, and I'll take those in a few moments as I wrap up the topic on consent management. So what I want to do next is share with you the result of consent rates from 2015 submission in EU. And as you can see that the rates varied significantly from country to country. For example, Sweden was around 85%, and Spain was nearly around 20%. And in terms of the consent rates, there is an inclination to, in order to meet some of these self-regulatory motivations that Elisabeth shared with you, organizations were encouraged to get reasonably high consent rates so that the transparency, which is the motivation behind the EFPIA directive, that motivation is met. And I also want to share with you that this information also varied by company. So I have masked out the names of the manufacturers, but I am sharing with you qordata research in 2015 just in Germany. And if you look at the consent rates that various companies experienced within Germany, they range from nearly 10% to as high as 99 to 100%, as the graph shows. So not just that the consent rates collectively varied significantly from country to country, as I showed you on the previous graph, they also varied meaningfully by company. So what does this mean to you as an organization if you are managing the collection of consent as well as reporting the spend? There are several things. Number one is that you want to first, from a consent management standpoint, have certain features in your mechanism for collecting consent. These are things that we would recommend in general. First one is security. Of course, it's very important because it's part of data privacy. You really do not want any of the spend information that's applicable to a specific individual be exposed. So you need to ensure sufficiently secure mechanism for collecting spend as well as consent. Ideally, you want the ability to provide multilingual capability for the physician to provide consent so that the language is clear. And the recommendation is to have English as well as a local language for that multilingual capability. Interoperability and encryption, which goes into, again, security. Interoperability is important so that you have multiple mediums to reach out to the HCPs and collect consent, as well as offer those mediums for revocation if needed. And then lastly, multi-channel. So you want to give, if possible, online ability for the physician to give and revoke consent, mobile through iPads and mobile phones, emails, and also certainly paper mail. So those are some of the recommendations around consent management that we want to suggest. Elisabeth already covered GDPR and some of the aspects to consent that the GDPR brings in. What I want to do is take the next 10 minutes to share with you, now that you have spend information that's aggregated both in US and EU, what are some of the types of data analytics you can consider to establish, develop, as well as extend if you want to extend your program globally beyond just EU or US, as the case may be in your situation. So here is our position on managing your spend as well as managing your information. And that position is, if you can't measure it, you really can't manage it. That's a view that comes from Peter Drucker, who's, of course, very well known in the space of business management. And a colleague of mine from Wyatt, who later on went on to work at Oracle, and I had the opportunity to co-author some of the parts of this book, was around Chief Performance Officer, where he talked about measuring what matters and managing what can be measured. So in that context, what we strongly recommend is for compliance organizations who now have access to these vast data sets to start preparing to benefit and leverage that data. And there are three concepts that I want to share in that context. First one is data analytics, which is basically the mechanism to analyze data, ideally in a more visual manner. The second thing is data alerts, which I would like to define as key compliance indicators. You establish those key compliance indicators, and then you let data analytics use those to give you early indication of relevant risks. And then lastly, the question on how to create those. There are several different mechanisms. What I'll do is in the next few minutes, I'll share examples of key compliance indicators and how organizations have utilized those in managing their compliance analytics. So I'll walk you through a quick example around proactive monitoring of your information. So this is a US-centric example. Apologies to the EU participants, but you can certainly apply this concept equally well to the various countries within EU that you are responsible to manage. So in this example, our customer has set up several different key compliance indicators, and based on those, several of them have been triggered where the conditions for the KCIs have been met. Example that I'll focus on is delayed expense report or timesheet submission by sales rep. Let's say that's of high value that has come up. Your dashboard would indicate that there is an issue based on your criteria for KCIs. Once you select Texas in this example, it'll show you the individual sales reps who have been delayed in submitting their expense reports, as well as other relevant data such as past occurrences. Next, I want to show you very briefly a blueprint of an analytics capability that's global. So on top, what you have are external data sets. I'm representing some US data sets at the moment, but you certainly have the EU EFPIA transparency data that's now published on several manufacturers' websites that you have as information to consider as you're evaluating your data sets. And certainly the internal data sets are very similar across US and EU. And if you were to build a capability that extended to both US and EU, you would then bring in the commercial data and spend data from EU as well and load that into your central repository. Elisabeth very judiciously gave you guidance on some of the data privacy and data storage requirements if you are including the EU data sets. But the basic principle of setting up key compliance indicators globally would still apply very much so. The system would certainly be able to handle and differentiate between states as well as countries and regions, the alerts that you establish, and then the result set would be very similar that I'll represent in the next few slides shortly. And I do intend to leave another approximately 5 minutes for some infographics that we intend to offer to the participants as well as questions. So in those public data sets that I called out, in US, you have around $34 billion worth of information. I've projected the submission of 2017 data in here, or around 52 million records. And in EU, you have around 6 billion worth of spend that has already been reported through 2016, and more would be coming in. In terms of the data sets, also you have the internal data set now exceeding 4.5 billion prescriptions in 2016, and of course, as you accumulate, that number is significantly more. And I have represented some of the internal data sets that we have worked with manufacturers for their internal analytics around compliance. I'm keeping an eye on the time, so I'll take a couple more minutes to address a few more examples of monitoring as well as analytics, and I'm going to go to some of the EU side of those examples, just to give a balance to the representation. So on the EU side, this is an example of the total spend across 4 countries that I selected: Germany, Italy, Spain, and UK. And in 2016 submission, Germany had the largest spend of euro 576 million. Now, if you were to build this analytics for your own organization, you would pretty much be looking at a very similar representation, except it would be specific to your own spend. And there you'd be able to look at how your spend spans across various countries. And certainly this pie chart could represent 33 or however many countries your organization currently markets your products in. Now, again, some other interesting data sets from 2016 submission, donations and grants. UK had the highest spend, which was euro 25 million. Germany, in this case, was lower at around 8 million. When it comes to consulting fees and physician fees, Spain had the highest spend, around 297 million, and UK at around 34 million. And again, this is based on the data sets that qordata had assembled, and I'm sharing some of those result sets with you. And then lastly, what this allows you to do is do a comparison and contrast. So if you as a compliance officer is managing your spend across all the countries in EU, you'd be looking at what are some of the points of commonalities by type, by spend type, besides the aggregated amount. So again, we're just giving you ideas on how some of the analytics can help for you to keep a tab on your organization as well as industry's activities. And certainly you can drill down to individual physicians and take a look at the individual physicians' activities in respect to their engagement with various manufacturers. So I would summarize by saying that when you're monitoring and building analytics, you want to make a decision on what you need to monitor, and then also a decision on what details you want and make those actionable. Elisabeth, I have one more question that has come in, which I will be directing towards you, if I may. So the question is that for consent management, if someone revokes their consent, are the activities that were performed before they revoked their consent still to be reported, and or how far back should someone be forgotten? That is, they have previously been reported to the various agencies, and now the physician has asked to revoke their consent, and I'm assuming implied in the question is that the physician may have also asked to be forgotten. If you could, if the question is clear, if you could kindly address that.
Yes, so if someone revokes his consent, first, all the activities that happened before the consent was revoked remain legal, of course. So if you, for example, published a report for 2016, and today the physician revokes his consent for this report, you legally published this report in 2016, but you will have to erase his disclosure from that 2016 report. And this is due to the withdrawn consent, and this is this right to be forgotten. So you have to erase him from that report, and if he wants to be erased from any documentation, you have also erased him from any documentation in your own documents.
Okay, and then same question around right to be forgotten. So if someone requests the right to be forgotten be enacted, what is the obligation in terms of deleting existing information around spend?
If someone wants to exercise his right to be forgotten, you have to delete any information around that. So you have to destroy your any information that you have stored for that person till now. So that's
okay.
That's the right.
And with respect to the information that has been sent to, let's say, third parties and agencies, do you have an obligation to inform those third parties and agencies to also remove the information?
Yes, you have to have the option to inform. Because you as company are the data controller, and you have to ensure that those data are processed correctly, and take also care that all the vendors you work with follow your instruction, that you instruct them to do also erase that. Of course, your obligation ends at that point. You cannot force them to erase, but you have to inform them and ask them to erase.
Excellent. Thank you. Appreciate that. So I appreciate all the questions that came in. We have a couple more minutes before we wrap up this webinar. And one of my colleagues, who's the business manager, business director at qordata, he has assembled some offerings for the participants. And his name is Tala Awan. He's a business director. So I'm going to allow Tala to maybe address you for a few minutes and share the offering. Tala?
Thank you, Ned. So I'm really excited for the attendees, because this is a giveaway that we're planning to send to all of you who've been listening in on the call. And these are just some infographics that we create for our customers. Generally, it's a visual way of showing them their transparency data that they submit to CMS and also voluntarily to EFPIA. So this is just a US infographic that we create. It sort of gives you explanations, visual elements on different spending patterns for your company that you've made publicly available. And similarly, we have one for the EU where similarly what we do is we do this for EU as well, where we show the spend across different areas, and this is all of course within the law at total and aggregate level. So I just wanted to come in and offer this infographic to all of the attendees. We would be sending this to you please send us a note if you would like us to send this one for you, if you don't have the correct email addresses while you register. And if you're interested, then we can, take the conversation forward in terms of how you can use the qordata analytics platform for meaningful analysis on this data. Thank you, Salah. Thanks for that offering. So participants, we will be wrapping up the webinar in 30 seconds. I want to thank Elisabeth for both her guidance in terms of the overall regulation and also her help with answering questions. So thank you from my side. I'll let Elisabeth say a couple of things before we wrap up this webinar. Elisabeth?
Yeah, thank you, Ned. Thank you for inviting me to speak. And please, if you have any questions or comments that come up around today's topic, please feel free to reach out. I'm happy to respond to any questions if you send them via email or so.
Super. Thank you. So that concludes our webinar today. Take care. Bye.